Hello everyone, I hope you are doing well. Today our lecture will be about the type of the specimen for diagnosis of the parasite. What the kind of the specimen that you are received in our parasitological lab and how we are diagnosed and what is the parasite that should be found under the microscope. So in this lecture we'll be covering this. The most common type of the sample that received in the parasitology lab is the stool. Why the stool? Because the most of the parasite is affected our intestinal and the most common sample for detected disease in the intestinal is the stool. The stool specimen, when we are examining it, we are looking either the helminthology or protozoology. If the patient have the helminth, we may be suspected we see the larva, the egg, and the worm. If the sample is the protozoa, we suspected to find trophozoite and the cyst, or maybe we found that oocyte. All these things we can suggest it to find it under the microscope if the sample is a stool. So, what we suspected parasite in the stool sample, the most common one, as we explained it in the theoretical lecture, here we found it in Amoeba histolytica, maybe the trophozoite or the cyst, the both may be found in the stool sample, and there is a most common one in Amoeba histolytica, and another one we have the Giardia lambelia, also it's a common in our country, and trophozoite and cyst also we can find it, Ascar lumbricoid, and also another kind of the helminth. We have many kind of the helminth we are found in the stool, but here we are giving the example of the some of these, but histolytic and Giardia is the most common one because you are mentioning it here. Here the picture of the cyst of the Giardia intestinal, we can say the Giardia duodenal or the Giardia lambelia. In this picture we can find that all this is a cyst. In these two pictures, the cyst of the Giardia is ovarian in the shape. It's a very important to focusing on the shape of the cyst in this slide, and there are the stained by the iodine stain and examined under the microscope. Here there is we can you found it. It's a very clear ovarian cyst in the stool sample, which is due to the Giardia intestine. Second sample that we are deal today, which is a blood specimen. The blood does not routinely come to the parasitological lab, but if there is a come, you have the some parasite suspected to affect the blood. So the blood sample we can find it in the parasite, of course, here. In this slide, we are talking about how the blood, the first things that will be collected from the patient, what is the material that you are requirement. It is required, of course, the sterilized cotton, wool swab, sterilized lancet, slide, disinfected puncture site by alcohol, or we have providing iodine, the blood and lymph storage in the small tube containing anticoagulation or the smear or the fresh smear. It will be prepared. It's meaning for diagnostic of the parasite by the blood sample, it should be collected in the anticoagulated tube, not the gel tube, anticoagulated tube, or we have to make a fresh smear is prepared. I talking about the whole blood. If we are using the blood for ELISA or for the serological test, here we are using the gel tube. But in the whole blood, if you are looking at the parasite, the sample should be collected in the anticoagulated tube. Here the expected parasite that we are found in the whole blood, the preparated by the blood smear, Trypanosoma, Leishman, and Plasmodium. Plasmodium, it is a species of the malaria, and in this picture you can find that there is a picture of the Plasmodium infected the red blood cell. So this picture is the red blood cell in the malaria case, as you found it that RBC infected and ruptured, and you found it the small drop purple inside the red blood cell, and that's very important to significate it or to distinguishing malaria from another case of the parasite that infected into the blood. So the third sample that we are suspected to find the parasite and receive it, we are received in the parasite lab. We are the urine collection. In the last lecture, we are talking about the urine collection as a general examination. We are not looking for the parasite, but in this lecture, when we are say the urine for the parasite, it is meaning the physician suspected the infection in the urethra, because of that send the urine to the laboratory to looking for the parasite. So the first, the very important, the collection of the urine, to give the instruction to the patient, because the collected of this sample is done by the patient, not by to that technologists at the lab. So it's very important to give them instruction, and the clear container should be as a label with enough information about the name of the patient and the time and the date of the collection. It's very important to give you a true result. Here, how the preservation of the urine. The urine should be direct examination or within the 1 hour. If there is not done immediately, we can put it at the refrigerator for the 4 degree, but not longer than 1 day. We can say not longer than 24 hours. Or if there is use it more than 24 hours, it should be urine preserved. We have some chemical component that use it for preserving of the urine, which is a very important, and you should memorize it: hydrochloric acid, boric acid, and formaldehyde. Boric acid is a most important preservative used to preserve a urine sample. So don't forget it and focus it. This is a very important to know what are the preservation that you use it for the urine sample: hydrochloric acid, boric acid, and formaldehyde. So here, what is the suspected parasite that we are founded? Most common one, Trichomonas vaginalis, may be also infected the urethra in the male, and also we can find it in the female also by the urine. We can be detected as this picture. You can find it. The first picture is a Trichomonas vaginalis trophozoite here. And the second picture, it is the schistosoma hematobium. The schistosoma hematobium that we are explaining in the first semester, which is infected the urethral bladder, and there is the egg of this parasite. So schistosoma hematobium is a kind of the helminthology, while Trichomonas vaginalis in the first picture that you are founded, it is the kind of the trophozoite or under the field of the protozoa. That both parasite we can found it in the urine sample. For sample that you are receiving in the lab, which is the skin scrub. The skin scrub, it is using aseptic technique, cleaning area in the over the lesion with a sterilized saline and sterilized gauze prior to collection. The area should be cleaned before the sample started to scrub. When you are scrub, it should be from the center and the margin of the kind infection by using normal saline or the mineral oil. And then they put the cover slide on it. Cover slip, and under microscope we are examined. And the most common parasite that affected and penetration through the skin and infected to the skin, we have the leishmania. We have the many kind of the leishmania, but it's very important to know the amastigoid of leishmania tropica, because some kind of leishmania infected in our blood. But here the leishmania tropica, we can say the continuous leishmaniasis, it is infected to the skin. And to diagnose this kind of the parasite, you are used by scrub of the skin, the site of the infection, and then under microscope we are examined. So here we have the skin swab. The skin swab also the sample of the skin. So here we are not like blood, there is another sample, it's the same thing. We have the lesion or we have any injury. If we have the deep lesion, we can be put it to the swab into that infected area, where into that superficial lesion. The first thing is very important to clear this area by using moistened gauze, and then the started to the sterilizing swab, rolling from that infected area and rolling very well to all the infected area. If there is any parasite or microorganism, is attached to this superficial or into the top of the swab, and then we are placed this swab into the gel tube, which is, we can say, there's non-gel tube, as you know, there's a tube of the collection of the blood. We're here talking about the transport media. The transport media which is containing a gel. That's meaning a transport media. We are put this swab in it, and then we are transported to the laboratory. So what's the skin scrub? There is an example of the skin scrub by Leishmania, amastigoid of Leishmania tropica, which is infected into the skin, and by scrubbing you can diagnose it. And as you found it here, the skin, the kind of the Leishmania infected as this arrow in this picture, you can focus it on it, and now there is a amastigoid Leishmania tropica. Here we have another sample, which is the sputum sample. Sputum sample is little bit difficult for the patient to be obtained. Sputum should be obtained from the lower respiratory passage with no saliva. Some patients make a mistake when they collected the sample of the sputum. They suspected there is a sputum while they collected the saliva. So it's very important to distinguishing if the specimen sputum or the saliva. If there is a saliva, we should reject it because it will give us the negative or we can say the false negative result. Sputum is getting easier to obtain it if there is a give instruction to the patient to collect it at that early morning, because in the first of the morning or early morning it's easier to obtain it the sputum sample. In which condition the sputum sample you are received in that parasite lab. If we have that ascard larvae and also we have the worm larvae in Amoeba histolytica. But in which case histolytica? Histolytica in the case of extraintestinal when infected our lung, in their case we should collect it that sputum to diagnostic of Amoeba histolytica. Another sample, we have the vaginal discharge. Vaginal discharge you are used to demonstration of the trophozoite usually done by preparation with mouth made from the vaginal swab or the scrubbing. This test we routinely done to detect the Trichomonas vaginalis. When the swab from the vaginal come to the laboratory, we are make that examination by preparated with amount preparation, added a small drop of the normal saline or distal water in the hand tube, and then we are examined under the microscope. In their case, we are looking if there is a patient have Trichomonas vaginalis or not, and the specimen should be examined immediately and not delayed. If there is a delay, we can make a smear and examine it to the later, because the sample mostly containing the trichomonas, and trichomonas don't have the cyst stage, only have the trophozoite, and trophozoite destroyed it very easier and fast. So in this condition, we have to examine the sample as much as possible immediately. Another sample we can use it to diagnostic of the parasite by tissue biopsy. This sample is a very rarely we are received in that parasite lab, and mostly this sample is done at the histopathological lab. Here, when the tissue specimens come, including the biopsy or surgically or necropsy specimen may be collected from the detection of the free-living amoeba. Why the sample we are collected? If we suspected the patient have the Naegleria fowleri or the patient suspected have acanthamoeba. In these two conditions, infected into our brain cell, and here the sample will be obtained by the tissue biopsy, and then you are examined by pap smear, and you are looked if our brain cell contain this kind of the parasite. But there is a very rarely done, especially in our country, because this case we are not is not presented in our country, so we are not focused on it. But also there is another way to obtain it, our diagnostic of the parasite by using the tissue biopsy.
بگیرم
Lenzicinde diyor ki kişneze.
بس